Hello, today we're going to discuss the very important topics of pain, comfort, and sleep. This can be found in your textbook, Chapter 31, starting on page 593. Upon completion of reading the Chapter 31 in your textbook and reviewing this presentation, you should be able to do the following. Discuss the applications of the Joint Commission's pain standards in planning patient care, including the clarifications of the standards. Give the rationale for why pain is considered the fifth vital sign. Illustrate the physiology of pain using the gait control theory. And describe the use of a variety of nursing interventions for pain control, including biofeedback, distraction, guided imagery, massage, and relaxation. After completing Chapter 31, you'll be able to provide the following to your patients in the clinical practice setting. You'll be able to assist the patient in accurately describing sensations of pain and discomfort, accurately and appropriately recording the patient's report of pain using clear description terms. Assist your patient in using the transcutaneous electrical nerve stimulation, also known as the TENS unit. You'll be able to effectively evaluate the effects of various techniques used for pain control. You'll provide care for your patient receiving patient-controlled analgesia, known as PCA, or epidural analgesia. Also, you'll be able to evaluate the effects of pain medication and accurately report and record these observations. So let's start off by describing what pain is. Pain is a feeling of discomfort strong enough to be intrusive and to affect or interfere with normal activities. It is experienced by the majority of patients sometimes during their healthcare experience. There is no accurate objective measurement of pain. Pain assessment is performed along with each assessment of vital signs, and therefore this is considered the fifth vital sign. Surgical patients can experience postoperative pain. Many medical conditions cause pain such as headaches, myocardial infarction, cancer, fractures, cuts, and abrasions. So why are there pain control standards? In this slide, we will review the Joint Commission's pain control standards. The approach to pain control has changed. The establishment of pain assessment and treatment standards and the expansion of pain management options are two factors now. The Joint Commission clarified these standards in 2014 as it relates to pain and the effects so that it focuses on the patient. The revisions made by the Joint Commission focuses on both pharmacological and non-pharmacological methods. In addition to that, it focuses on increasing benefits and decreasing risk to the patient when deciding the most effective pain strategies. The following standards are related to direct patient care. The patients have the right to appropriate assessment and pain management of pain. Pain should be assessed in all patients. Patients are educated about pain and managing pain as part of the treatment plan, as appropriate. Also, the discharge process provides for continuing pain care based on the patient's assessed needs at the time of discharge. Revisions focus on including, again, both pharmacological and non-pharmacological methods in addition to the benefits and risk to the patient when deciding the most effective pain management strategies. So what are some theories of pain? Pain is defined as a feeling of discomfort, distress, or suffering caused by the stimulation of nerve endings. Acute pain is often a warning of potential or actual tissue damage. It allows the sufferer to withdraw from the source or to seek help in relieving symptoms. Pain is transmitted to the brain through the nervous system. Figure 31-1 shows you pain transmission. This can be found in your textbook on page 595. So let's review the gate control theory. The gate control theory starts on page 595 in your textbook. The gate control theory was first described by Melzlack and Wall in 1965. Pain transmission is viewed as being controlled by a gate mechanism in the central nervous system, or CNS. Please see figure 31.2 in your textbook. The gate control theory stated in the simplest terms that opening the gate actually allows the transmission of pain sensation, and closing the gate blocks the transmission of pain. Several ideas that affect the nursing practice are part of the gate control theory, including the gate may be reopened by activity in a small diameter nerve fibers from such things as tissue damage. Activities in the large diameter nerve fibers, such as that provided by massage or vibration, seems to close the gate. Again, figure 31-2 can be found in your textbook on page 595. So, have we all heard this terminology, endorphins? So what are endorphins? Endorphins are endogenous, naturally occurring opiate-like peptides that actually reduce or block the perception of pain. The word endorphin actually comes from morphine and endogenous. Like morphine, endorphins attach to the nerve endings in opiate receptors and block pain transmission. Both physiologic and psychological stressors can release endorphins, resulting in a reduction of pain and an increase in the sense of well-being. Pain descriptions. Determining the type and intensity of the pain the patient is experiencing assists in selecting methods that will best relieve that discomfort. The patient's verbal description of pain, nonverbal signs of pain, and physiologic indicators of pain may vary according to the type of pain the patient is experiencing. Treatment decisions should be based on assessment that considers all these factors. Assessment of the patient's pain should include the following. Describe the severity of pain based on the patient's pain scale. Describe the quality of pain, location of pain, duration of pain, and the degree of pain. We are going to discuss the various types of pain. Pain can be referred to as acute, chronic, nociceptive, neuropathic, and phantom. So what is meant by the term acute pain? Acute pain is usually associated with an injury, medical condition, or surgical procedure. It is of short duration, lasting for a few hours to a few days. Acute pain may be described by your patient as achy or throbbing. Patients may be restless or agitated, and usually it is controlled with analgesics. Injuries causing acute pain may include burns, bones, fractures, and muscle strains. Medical conditions causing acute pain may include the following: pneumonia, sickle cell crisis, angina, herpes zosters, inflammations, infections, and blockages. Acute pain may be described as, again, as achy, throbbing, or even searing. It may worsen in the presence of anxiety or fear. Is usually relieved once the cause is removed. So what are some types of pain in referring to chronic pain? Chronic pain may be pain that continues on for months or possibly years. Chronic pain is associated with ongoing conditions such as arthritis or chronic back pain. It may be described as dull, constant, shooting, tingling, or burning. Chronic pain may be treated with both pharmacological and non-pharmacological interventions. Nociceptive pain. Nociceptive pain involves injury to the tissue in which receptors called nociceptors are located. Nociceptors may be found in the skin, joints, or organ viscera. Injuries triggering nociceptive pain may be caused by trauma, burns, or surgery. Nociceptive pain involves 4 phases. Transduction, which begins when the tissue damage causes the release of substances that stimulate the nociceptors and starts the sensation of pain. Transmission involves movement of the pain sensations to the spinal cord. So if you can remember that, transmission involves movement. Perception occurs when the pain impulses reaches the brain and the pain is recognized by the patient or individual. Modulation occurs when neurons in the brain send signals back down to the spinal cord by release of transmitters. Treatment of nociceptive pain may be directed towards one or all of the 4 phases. Non-steroidal anti-inflammatory drugs, also known as NSAIDs, work by blocking the production of the substances that trigger the nociceptors in the transduction phase. Drugs that interfere with the transmission phase include your opiates. Non-pharmacological treatments such as distraction and guided imagery may be effective during the perception phase. Drugs that block neurotransmitter uptake work in the modulation phase. Neuropathic pain is usually associated with a dysfunction of the nervous system, specifically an absorption abnormality in processing sensation. Pain receptors in the body become sensitive to stimuli and then send pain signals more easily. Nerve endings grows additional branches that send stronger pain signals to the brain. The changes in the nervous system are often associated with medical conditions rather than tissue damage. Medical conditions include diabetes, Guillain-Barré syndrome, multiple sclerosis, cancer, HIV, and nutritional deficiencies. These conditions are examples of medical conditions associated with neuropathic pain. Analgesics and opiates alone usually do not relieve neuropathic pain. Neuropathic pain is sometimes managed with common analgesics such as those in the NSAIDs family, but also increasingly with adjunctive medications such as a tricyclic antidepressant, anticonvulsive, and corticosteroids. Individuals who may have undergone an amputation may experience phantom pain. Phantom pain occurs After the loss of a body part of an amputation, the patient may feel pain in the amputated part for years after the amputation has occurred. If this cannot be controlled with conventional methods, the pain may be controlled by the use of TENS units being implanted into the thalamus. Quality of pain and perception of pain. One of the most difficult aspects of pain management is the assessment of pain and the evaluation of the effectiveness of interventions. Assessment of pain is whatever the patient says it is. Observable indicators may not always be present include moaning, crying, irritability, grimacing, frowning, or rigid posture in the bed. Perception of pain may be described as rushing, throbbing, pulsating, twisting, pulling, burning, searing, stabbing, tearing, biting, blinding, nauseating, or debilitating. When you are assessing your patient for pain, you want to consider the location of the pain. Assess the area of the pain and identify it as what body part is being affected by the pain, such as whether it's the foot, the hand, the leg, etc. Also, describe the pain as being localized, radiating, or generalized. In addition to that, describe the frequency of the pain and assess the patient's complaints of frequency of pain. Are they complaining for the pain of being constant? Is it intermittent, or is it occasional? So in your practice, when you're assessing your patient's pain level, you're going to use a tool. The tool includes the pain scale. There are a variety of pain scales you can consider. The first one is the numeric scale, the number scale. A numeric scale is often used to help a patient rate the pain level from 0 being pain-free to 10 being the worst pain imaginable. In addition to that, you can also use a pain scale. The pain scale shows them faces in a variety of degrees of pain. This allows the individual to point to the scale rather than verbally expressing a number. Please familiarize yourself with the variety of pain scales found in your textbook on page 598 and 599. This figure, 31-4, is an example of the pain scale, pain numeric rating scale. This again can be found in your textbook on 598. Figure 31-5 shows the Wong-Baker face pain scale rating for children. This again can be found in your textbook on page 599. So pain control methods. Let's discuss some non-medical methods in controlling pain. The transcutaneous electric nerve stimulation, also known as the TENS, can be used in managing pain. It uses a small electric stimulator attached to the electrodes to block pain. The percutaneous electrical nerve impulse or stimulation, the PENS unit, is a treatment showing promise for relief of lower back pain, such as that is caused by sciatica, and for the relief of some headaches. Additional pain methods and non-medical methods include binders, application of heat and cold, relaxation techniques, biofeedback, distraction, guided imagery and meditation, music, hypnosis, and massage. Figure 31-6 shows you an example of the TENS units. This can be found in your textbook on page 600. So what are some medical methods of managing pain? Pain can be managed by the use of analgesics. Analgesics are prescribed when patients are experiencing pain. Your responsibility as a nurse is to monitor the patient's pain level and administer the medication as ordered. Analgesics can be prescribed as oral, topical, injected, or intravenous. Patients may also be prescribed patient-controlled analgesia, known as PCA, or epidural analgesia. Figure 31-9 provides you a picture of a portable PCA being used by a patient. This can be found in your textbook on page 605. Okay, let's do a quick check regarding pain and let's see what you've retained, okay? So let's go through some questions here. So question number 1, there are several types of pain. Which type of pain occurs after the loss of a body part from an amputation? Is it A, acute pain? Is it B, nociceptive pain? Is it C, neuropathic pain? Or is it D, phantom pain? The correct answer here is D. Next question. Question 2. Kathy is working in a mother-baby unit. Which pain scale is used to determine if the baby is in pain? Is it A, FACES, used for pain rating scales for children? Is it B, FLAC scale? Is it C, your PIP scale? Or is it D, NIPS scale? For your information, NIPS refers to as neonatal infant pain scale. Therefore, your answer is D. The neonatal infant pain scale is used in assessing pain in babies. Question 3. Karen's patient is prescribed a COX-2 inhibitor. For this information, refer to your textbook on page 604. Table 31.2 provides you with an in-depth table of categories of analgesics and examples. Which of the following below is an example of a COX-2 inhibitor? Take a moment to review this information. Is it A, aspirin, B, morphine, C, anti-inflammatory, or is it D, antidepressant? The correct response is C. In your textbook again, on table 31.2, page 604, provides you examples of COX inhibitors. Anti-inflammatories fall into this category. All right, now we're ready to move on. Overview of sleep. The objectives here would be that you would be able to learn the following: analyze the need for normal sleep, recognize how the need for sleep changes over lifespan, delineate factors that can interfere with sleep, and define the sleep disorder such as insomnia, sleep apnea, and narcolepsy. You'll bring the following knowledge to the clinical setting practice. You'll be able to gather data regarding a patient's sleep difficulties. And also, you'll learn to develop a plan designed to assist a patient in getting adequate sleep. Let's move on. So, why is sleep so important? Let's describe and discuss the functions of sleep. Adequate rest and sleep is important for a variety of reasons. Sleep influences memory, mood, cognition function, secretion of various hormones, immune function, body temperature, and renal function. Adequate rest and sleep are important factors in general health and recovery from illnesses. In addition to that, adequate sleep also plays a major role in pain control. So remember this, that adequate sleep actually affects an individual's pain control. Being well rested increases pain tolerance, and allows improved response to analgesia. Stages of sleep. So normal sleep follows a course of 2 stages. One stage is called non-rapid eye movement, which is the NREM sleep, or NREM sleep, and the rapid eye movement cycle is called the REM cycle. So rapid eye movement sleep, or the REM sleep, is the time in which you dream and a period of high level activity occurs. During this process and cycle of sleeping, the heart rate, blood pressure, and respirations are similar to the levels of being awake. During the non-rapid eye movement sleep cycle, it is believed that during this time is when the body actually receives the most rest. The heart rate, blood pressure, and respirations decline. The amount of sleep an individual needs varies from person to person, and the amount of sleep needed changes as a person passes through the life cycle. Please note, this slide has the various amount of hours needed depending on the individual's age and life cycle. There are many factors that can disrupt the normal sleep cycle. People who work evenings and night shift often have difficulties sleeping during the day. Workers who change shifts during the months had even more difficulties adjusting in order to get enough rest. Travelers may suffer from jet lag as they go through different time zones. Several hours of sunlight exposure helps resist one's internal clock. People who snore or have partners who snore may find that they are awakened frequently. Lifestyle can affect the ability to sleep, such as caffeine consumption, nicotine, or alcohol consumption. Regular exercise can help a person sleep, but exercising too close to bedtime may be overstimulating and may keep the patient or individual awake. Stress and illnesses also affect sleep. And also, environmental factors such as a room that is too hot or too cold, too noisy, or has ambient light can also affect sleep. Insomnia. So what is insomnia? Insomnia is actually referred to as the difficulties in getting sleep or staying asleep at night. Insomnia may be short-term, lasting only a few nights, or chronic, lasting months or longer. Transient insomnia may be caused by stress, excitement, or changing in sleeping arrangements and occurs when traveling. Chronic insomnia may be the result of an underlying medical condition, behavioral, or psychiatric problem. Depression can also cause insomnia. Individuals suffering from chronic insomnia may require treatment from a healthcare provider specializing in sleep disorders. So sleep apnea is a condition in which the patient stops breathing for a brief period of time during sleep. There are three types of sleep apneas known as obstructive, central, and mixed complex. In addition to these categories, they can be classified as either being mild, moderate, and severe. Obstructive apnea is the most common type. It is caused by the relaxation of soft tissue, which allows partial to total obstruction of the airway. Also, this condition may be further complicated by tissue or bony structure abnormalities. Obstructive apnea may be treated by the use of what is called a continuous positive airway pressure device, also known as a CPAP. Central apnea is caused by a failure of the brain to communicate with the respiratory muscles. This results in the cessation of breathing with no observable respiratory effort. Mixed apnea is a combination of both. Did you know that snoring is actually a sleep disorder? So what is snoring? It is harsh sounds caused by vibration and/or obstruction of the passages at the back of the mouth and nose. It may be caused by poor muscle tone, excess tissue, or deformities such as a deviated septum. Snoring, there is a partial blockage of the airway. Sometimes it is relieved or corrected by sleeping on the side or an individual losing weight. Narcolepsy. Narcolepsy is referred to as a sudden, onset, recurrent, uncontrollable, brief episodes of sleep during normal hours of wakefulness in a well-rested person. These sudden sleep periods may occur at any time and last for a few seconds to more than 30 minutes. Symptoms usually begin by the age of 25 and may start as excessive daytime sleepiness. There is currently no cure, but drugs and behavioral therapy have been proven to be helpful. Question 4 pertains to the concept or the content covered in your sleep disorder section. Karen's patient is experiencing sudden onset, recurrent, and uncontrollable brief episodes of sleep during hours of wakefulness. Which condition is this? Is it insomnia? Is it B, sleep apnea, C, narcolepsy, or D, REM sleep? The answer is C, narcolepsy. We just covered that. Next question. Okay, final question, question number 5. The content covered on this particular question and on this slide can be found in your textbook on page 612. The use of sleep aids. Karen's patient is going home with a prescription for a sleep aid. When teaching the patient about the medication, Karen should be sure to include which of the following. Is it A, medications should be used with alcohol? B, medications for sleep are for short-term relief? C, over-the-counter medications for sleep will keep you alert? Or is it D, hypnotics are not used for sleep? The answer is B. Medications, sleep aid medications are used for short-term relief. Again, review the content on page 612 in your textbook. The end. This concludes my presentation on pain, comfort, and sleep. Thank you.